Being a nurse is great. Being known as that nurse, not so great. How can you avoid this notorious label that may follow you in practice is simple. As an experienced nurse with a few gray hairs of wisdom to go with it, I have observed that it is the little things that a nurse does or does not do that are really the big things that make a difference to your patient and the nurses you work with. Here is my list of pet peeves in practice that will help you as a nurse start strong and keep you from being ever labeled as that nurse. Number 1, make sure the peripheral IV is taped and well secured. I have been flabbergasted by how often I find the peripheral IV held in place by barely one piece of tape that is already beginning to peel off. Don't be that nurse. When you assess your patient for the first time, check the IV site for signs of infiltration, but be sure that it is also well secured. If not, take 15 seconds and use a couple of pieces of tape to secure. Better that than to needlessly start an IV because it accidentally came out. Number 2, keep your patient clean. It used to be that morning or HS cares included a sponge bath, oral cares, and a clean gown. I have noticed that some nurses do not make it a priority to provide basic cares that will keep a patient feeling fresh and clean. Don't be that nurse. Know when basic hygiene was last done and take the time to offer oral cares or a quick refresh or delegate this task so that the patient has the chance to start the day clean with no residue. Remember the golden rule, as you do unto others, as you would want that done to you. Number 3, shave your male patients. If a male patient does not have facial hair, don't let it start while he is your patient. Since most nurses are women, they cannot identify with what a 3-day growth of stubble on your face feels like. Trust me, you feel scruffy and feels like you have a dirty face. Don't be that nurse. If your male patient has noticeable stubble, take a couple minutes to shave him. He will feel better when his face feels clean and freshly shaven. Number 4, keep the room clean and in order. Though I do not believe that I have OCD tendencies, I am surprised to see things on the floor that belong in the garbage or in the patient room that I assume care on. A half-eaten dinner tray that is still there hours later, and general disorder on the nightstand or bedside table. Don't be that nurse. Take a minute and get the room in order. Remember that the essence of Nightingale's emphasis that brought nursing out of the Dark Ages was the importance of a clean environment to bring healing. Be intentional to make sure that the room of each patient is clean and in order at all times that you care for. And finally, number 5, keep the sequential compression devices, those sleeves, off the floor. I am amazed at how often I find these SCD sleeves on the floor instead of being tucked in at the foot of the bed when they're not on the patient. Last time I checked, the floor of any clinical setting is dirty and anything that touches it is contaminated. Don't be that nurse. If SCD sleeves are on the patient, tuck them in at the footboard and keep them clean. This little step may even prevent your patient from getting an unnecessary infection. What is your practice pet peeve? I'd love to hear it. Post a comment on this tube and let me know what you're thinking. Then like this video and share it with someone who would care. If you haven't already, subscribe to this channel to be first in line to get fresh content that will help you be better prepared for practice and never be known as that nurse.